Hi guys. Hello everybody. Thank you for attending. I see a lot of questions about vaccines. We're going to get to a lot of it. And hopefully we can also get to your questions in the question and answer session. But I do know that we're running about 10 to 15 minutes behind. So I want to jump in and start sharing my screen with you guys. And hopefully we can get this working, okay? Ooh. Hold on one second. Oh, just the luck. There we go. Let me see if I can find all. There you go. Much better. All right, guys. Can you guys nod if you can see my screen? Beautiful. All right. Let me get into presentation mode. All right, guys. So again, as it was mentioned, I am Dr. Kimberly Petrick. Thank you so much for taking the time to be with us today for this COVID-19 vaccine webinar. I am a family medicine physician that is based out of Southern California, more specifically, Santa Monica Medical Office Building. And of course, I'm associated with Kaiser Permanente. I don't know if you guys can see yourselves on the corner, so I'm just gonna move that just in case you can. We are working tirelessly behind the scenes to make sure that everyone who is eligible to get the vaccine is getting vaccinated. And so I hope that today you will leave here with a little bit more knowledge, feeling more comfortable about the vaccine, and making sure that this is the right decision that's for you. Now, one caveat here is that this is all rapidly changing. It is a changing science. And so what we talk about today may not be the same as what we talk about tomorrow, a week from now, even years from now. And so we hope that the principles stay the same and that you guys will at least get the knowledge that you need to make an informed decision on whether the vaccine is right for you. So with that said, let's take a stab at this. No pun intended with the needles and the stab. Get it where I was going with that? Okay, so first, it's important that we all understand why we so desperately need a vaccine against this virus that causes COVID-19 in the first place. And the reality is that there's really no other good option. We are not going to fix this pandemic if we do not have a vaccine. The virus spreads quickly and easily from person to person. And the scary thing is that you can actually spread the virus days before you even know that you're sick. Also, as we see with Britain and South African, the Brazilian variants, this virus can mutate and become even more spreadable than others, especially than that we once saw. It's pervasive and it's everywhere right now. It also wouldn't be a very big deal if it really caused only mild illnesses like the common cold. But unfortunately, the very scary part of it is that people can get very sick from this, and some people can even die, like we've seen with over 500,000 people now that have lost their lives. This virus can be very dangerous for certain people. Also, the virus can be very challenging to diagnose. Whether people don't know that they have it, they don't want to get tested, they have false negative test results, meaning they go out thinking they don't have the virus, or at one point there was even a shortage of testing supplies. Plus, the test doesn't feel good, so it deters a lot of people from wanting to get tested. There are a lot of reasons why diagnosis has not been so great. And we don't have herd immunity. So despite the fact that COVID has now been around for about a year, and despite all of those crazy surges, if you can believe it, the penetrance in our society is still only 20%, nowhere near that 60 to 70% that we need to consider ourselves herd immunity. And so as a population, as a whole, we continue to remain unprotected. And when someone does get sick, it's really hard to treat. Yes, we've heard a lot about things like monoclonal antibodies, remdesivir, and all the things that we're doing, but none of them are great solutions. So for all of these reasons, we have a virus that's contagious. It can be deadly. It's hard to test for and not easily treated. The only thing that's going to save us all is an effective and safe vaccine. So I know that there are a lot of questions and concerns on how the vaccine is made. Obviously, it does not inspire confidence for anyone when we hear about political figures saying that they're trying to rush out the vaccine. make sure they're going to get it done before the election. And if you look at people that were polled as to whether they would get it at the time, the numbers dropped significantly because people felt like it was being rushed. And it really changed the perspective of our society of not being prepared in a safe way for this vaccine. But I can tell you that this is absolutely untrue. Yes, they worked very fast, but hopefully after this, you will see that these trials are the same as they would do for any vaccine trial, just done a bit more creatively and a bit quicker. So let's talk about vaccines. And here you go. This is your needle with a vaccine. For any vaccine, say for a typical disease, you go through a number of stages. We start with the preclinical stage, testing on animals to see if the vaccine creates an immune response. Generally, they start in mice, then they move to monkeys. Yes, poor animals. But as a famous vaccine researcher once said, mice lie and monkeys exaggerate. Only humans tell the truth. And that's why human studies are necessary to study the safety and efficacy of a vaccine. So after these preclinicals comes the phase 1 trials. This is their first attempt to assess the candidate vaccine in humans. And this involves small group, usually between 20 to 80 people. The goal of phase 1 testing is to assess the safety of the candidate vaccine and to determine the type and extent of immune response that occurs with the vaccine, and if it's even good for humans. So once this is done, then we move to phase 2 testing, where a large group of several hundred individuals, some of whom belong to an at-risk population for acquiring the disease, and then here they look at the vaccine safety, immunogenicity, proposed doses, schedule of immunization, and the method of delivery. Are we going to give it in the nose, the arm, the leg? What is the best way of getting the vaccine? And then comes the real study.
Dr. Petrick, can I
Yes.
interrupt real quick?
Yes.
It looks like we have our interpretation set up, and
Yes.
I just want to let the members know so that they can understand, hear what you're saying for them and stuff.
Oh, good. Yes. I think she was actually messaging in the Q&A thing before we even got started.
Okay, interpretation is available. Los que quieran oír esto en español pueden ver el icono donde dice interpretation al lado derecho de su pantalla y opriman y escojan español. Gracias.
Lo siento, yo estoy corriendo ahorita porque yo sabe que tenemos mucho que hacer, but I'm glad you have an interpreter. So where were we? Okay, phase 3. Can I go back, Coronado? Is it okay?
Go ahead, go ahead.
Perfect, thank you. Okay, I just want to make sure we get through all this, and I know you guys have so many other things to do as well. So here we come to phase 3. Again, this is the real test. This is when they now start getting thousands to tens of thousands of people that are randomized and double-blind testing for this experimental vaccine. Usually it's the vaccine versus something we call a placebo, basically water or saline. So half the population will get the vaccine, the other half will get a water or saline injection. Remember, at this point, they've already worked out what is the appropriate dose, the safety, the interval doses between the doses, and how the vaccine should be given. So phase 3 assesses really the vaccine safety in a larger group of people. Also, they look for the rare side effects that may not have actually come about in the smaller groups in the earlier phases. It also tests for vaccine efficacy. Basically, what does that mean? It means, does it prevent the disease, prevent infection with the pathogen? Does it lead to the production of the antibodies that we need to protect ourselves? So we wait for a certain number of people who actually get the disease to see if more people with the placebo versus the vaccination actually got infected. In general, the vaccine companies begin to scale up manufacturing sometime between phase 2 and phase 3. But large-scale manufacturing doesn't actually occur until the approval process. So when licensure actually seems more likely. And after they get the data from the phase 3 trials, this is when the vaccine developers will submit for approval to a biologics license application to the FDA. Generally, this process takes a long time, like more than a decade. And this is why there's so much concern that surrounds this. However, now we simply just don't have that luxury, right? We're in a pandemic. So instead, what we've been doing is doing all of this, but in a quicker fashion. So you still have the same number of participants, still have to wait the same amount of time to see if people get disease or not. But in this case, we knew people were getting infected quicker because of all the surges that we've seen. So we thankfully, but unthankfully, this disease is not rare. Many people are being exposed to the disease and a lot of people are becoming infected. So when we look at this, we look at how many were infected with the placebo versus the vaccine, and that's how we get our statistical significance sooner and quicker to know how the vaccine is working. A lot of companies did combination phases, such as phase 1 at the same time as phase 2, or phase 2 at the same time as phase 3. And you know what? That's okay, as long as you do all the phases. Even the FDA approval, rather than the FDA taking their standard meetings and meeting every few months, the FDA also had emergency meetings, reportedly not sleeping for weeks at a time to try and make this happen for us by reviewing data and looking at this with the same level of scrutiny as they would for any other vaccine, just on a sped up basis. Now, we've also heard about this Operation Warp Speed, which I will admit sounds like an episode of Star Trek. And this does not mean that they were cutting corners on phase 1 or using fewer participants in phase 2 or any of the various stages. Warp speed simply means that their manufacturing was sped up. For typical large-scale manufacturing, they do not do manufacturing until the vaccine is almost approved. But right now, again, we just don't have that luxury. So instead, what happened was they said, hey, Moderna, Pfizer, whatever company we're looking at, we're going to give you $1 billion. And what we want you to do is start making the vaccine now, before you've even finished your phase 3 studies. We think that your vaccine is going to work. So we're going to give you money to make as much vaccine as possible so that if you do become approved, you have the vaccine on hand and are ready to start distributing immediately. It is a gamble for sure. So let's just say Moderna came back and had 5% effectiveness or 0% effectiveness. Well, then the FDA would have come back to Moderna and said, hey, we're not going to give you that emergency use authorization. And then $1 billion of vaccination would have been lost. But luckily, that's not what happened, and the gamble paid off. But this is what warp speed was. It gave companies the ability to take that gamble, make the vaccine before they even knew 100% certain that it would truly be effective. Again, this does not mean that corners were cut. I hope that this makes sense. And also, it won't hurt to mention that even after licensure, the FDA will continue to monitor the production of the vaccine, including inspecting the facilities and reviewing the manufacturer's tests of lots of vaccines to make sure that potency, safety, and the purity of the vaccines are still on point. After approval, meaning post-licensing, a number of systems continue to monitor vaccine safety, and we'll chat about that a little bit later. So historically, almost every antiviral vaccine ever sold works in a similar way by introducing a dead or a weakened virus or a piece of one into a healthy person, which will then stimulate an immune response in the body so that the body creates antibodies, which will protect us then from the actual virus or infection. The traditional vaccines have worked incredibly well over the years for diseases like smallpox and polio, but they're difficult to manufacture on a massive scale and slow to develop. So right now, there are a number of new and improved vaccine platforms that are being explored. And I mean like over 100 different companies were bidding to create new vaccines. Some vaccines were these new genetic vaccines, like mRNA vaccines, which we're going to talk about in a bit more detail very soon. There are also viral vector vaccines like AstraZeneca and this new Johnson & Johnson, which, just of note, submitted for their emergency use authorization earlier this month as well. And there's also a Russian vaccine called Sputnik 5, which is also showing to be very promising as well. And all of these use something called a weakened adenovirus to transport the vaccine component into our body. So yes, we're using a virus to fight a virus, but it's been altered a little bit. So it does technically infect us, but it only does this to inject a gene to help make the spike protein. The adenovirus itself is weakened, it's unable to replicate, it doesn't actually give us an infection into our body. It just kind of serves as the transport medium into ourselves. So that's the AstraZeneca and Johnson & Johnson, which are not out yet. You also have the protein-based or whole virus vaccine, which is what we have used traditionally that we just talked about a little while ago, such as the flu vaccine. This takes a long time to produce. For example, you have to grow the virus, then take off the proteins from that virus, purify the proteins so you don't infect a person, then you make sure you have enough of them, then you put them into a vaccine. It's a huge, long process. And it's not ideal for a pandemic where you need to immunize as many people and a whole population as quick as possible. Some people are even looking to repurpose old vaccines like BCG vaccines, for example. There is a study that's going on in Australia, but this doesn't look like it's going to be the most promising way to go. So instead, the one we're going to use is what we call this genetic vaccine, and these are remarkable. Yes, new technology, at least for us, but actually the concept of the mRNA is not new at all, and they've been working on it since the 90s. Believe it or not, you can actually treat some cancers with this technology, where they can actually target malignant cancer cells with the mRNA. They have done clinical trials in the past for rabies, flu, and Zika, but Zika, fortunately or unfortunately, kind of burned itself out, and so the clinical trials were no longer needed. However, the challenge was, over time, injecting the mRNA into the body didn't actually give a great immune response because the body was breaking it down too quickly. But in recent times, there have been new technologies and breakthroughs in terms of RNA biology and chemistry, where they've actually been able to improve the delivery system, stability, safety, and the effectiveness. So when we look at vaccines like this one, that uses this type of technology, we're talking about the Pfizer, BioNTech, and Moderna. So let's look at Pfizer one first, okay? You can see that this is an mRNA which received its emergency use authorization on December 11th. It was studied on a population of 16 years and older, given as 2 doses, 21 days apart. Also, this is because this is how the study is determined to be most effective. It's what they determined. So 21 days is what Pfizer recommends. But the problem was that the vaccine has, and as you may have heard, that the vaccine has to be stored in ultra cold temperatures, ultra cold freezers, minus 70 degrees. So that does make it a little bit challenging. And then we look at the Moderna vaccine, basically the same kind of vaccine, except that it got its emergency use authorization 1 week later because it filed 1 week later than Pfizer did. And its study was actually done on 18 years and older and 28 days apart. Both of these vaccinations have a little bit of wiggle room. We do recommend getting it 21 or 28 days, but you can get it a few days later. You don't have to restart the whole cycle, but you do need to get both for it to be effective. And the Moderna, of note, is stored at normal freezer temperatures. So let's talk about the mRNA vaccine. There are a lot of myths and misconceptions that are out there about the vaccine because they're rumored to be so new. But as we just discussed, they've been around for a few decades. For example, the most common inaccuracy that's going on right now is that it integrates itself into your DNA, or it changes your genetic code, or it gives you COVID for that matter, all of which are completely untrue. And let's talk about why. Again, this is a SARS-CoV-2 virus. It's a coronavirus that we call COVID. The SARS-CoV-2 virus is studded with little proteins that look like a crown, kind of in this picture. Look at that spiky looking thing that's on the left picture there. Do you see those little spikes? Well, those spikes are what infect us. So of course, what do we want to do? Well, we want to make antibodies against those spikes so that they can't affect us, right? So older generation vaccines would have likely aimed to inject those spike proteins directly into us, so our body learns how to make the antibodies to that directly. But what's so cool about this mRNA vaccine is that scientists decoded COVID's whole genetic sequence early on and found out how to actually teach our body how to make that virus's spikes so that our body can actually make their own antibodies against that intruder protein, ever having to be exposed to the virus itself. It's so cool. So in the event your body is ever exposed to the virus, it will have now built its own arm of defense because it's built its own proteins and its own antibodies to those proteins. I hope that makes sense. Think of the messenger RNA as a tutor who brings you the best book you've ever read in your whole life, or in this case, a great abridged Protein for Dummies handbook, and then disappears as soon as it teaches you all that it knows. The mRNA is what our body reads to make the spike proteins, and then it's broken down immediately after it's been used. It doesn't hang around to alter our cells, and for that matter, it doesn't go anywhere near our DNA. It can only enter a totally different part of the cell called the cytoplasm. Now, with any vaccine, there are really only two questions. Number one, does it work? And number two, is it safe? So let's talk about this. Well, does it work? The answer is yes. And if you look at either the Pfizer vaccine or the Moderna vaccine, they both work exceedingly well. You know, the hope from the FDA initially is that we hope that the vaccine would be at least 50% effective or more. But we did not expect the vaccine to be as effective as it was, though we're thrilled that it is. So when we look at people who came down with COVID in the studies, the vast majority were the people in the placebo group, meaning the people who did not get the vaccine. When we look at the effectiveness or the efficacy, because we like to look at things in more of a perfect or ideal condition for the vaccine showed to be 94 to 95% effective, depending upon which vaccine you're using. And it was true across the board. You can see the same with Moderna. And they did a really good job with both of these studies to include all races and ethnicities to reflect our population as a whole. They looked at different age groups, different underlying illnesses, all sorts of things. So with 44,000 people in Pfizer's study and 30,000 in Moderna's, there was a really good sample size of over 70,000 people that they tested this vaccine on. So who can get the vaccine, you may ask? Well, there are a few factors that we want to consider here. First off, what if you have already had COVID? Can I still get the vaccine, doc? Well, the answer is yes. Not only can you, but you should definitely get the vaccine because studies are actually showing that the immunity from the vaccine is actually better than the infection itself. However, you do want to wait at least 10 days to get the vaccine from the period supposed to be in isolation, mostly because you don't want to expose anybody else when you're supposed to be home quarantining and having that active disease. But there's no minimum waiting time for after you've had COVID infection and are out of isolation. The only exceptions to this is if you got the monoclonal antibody therapy or convalescent plasma when you were sick. And really, most people haven't gotten that therapy. So in which case, then you want to wait 90 days before you get the treatment. Also, we're still in vaccination shortage, as I'm sure many of you guys know. And so we're recommending that you also wait 90 days after your infection, assuming that your natural immunity is still working to defend you for now. What about other vaccines? Doc, can I get my flu vaccine at the same time as my COVID vaccine? Well, the answer is we shouldn't be doing that. It's really more of a theoretical concern with hopes to avoid muddying the data, right? If someone has a reaction to one of the vaccines, we don't want to misappropriately say that it's from the flu or any other vaccine instead of from the COVID vaccine and vice versa. So for that, the recommendation is to wait for 14 days after you get any other vaccination, or similarly 14 days before, so you don't actually get anything confused for side effect wise. But if you accidentally get 2 vaccines at the same time, really, it's not a big deal. And what about if I'm pregnant or you're pregnant? You know, the study is not completely done for analyzing how this does affect pregnancy. However, with all the scientific data for women who did get the vaccine while they were pregnant, most of the time it was unintentionally, it does appear to be safe. And the American College of Obstetrics and Gynecology did come out and say it was fine and recommended for pregnant women, and largely because the risks versus the benefits, right? The risk of severe COVID in someone who is pregnant is unfortunately higher than any theoretical risk of a vaccine. But it's always important to make that decision with your healthcare provider. So talk to your OBGYN. If a pregnant woman does get the vaccine, especially after dose number 2, and she does get fevers, make sure that you're taking Tylenol. Fevers are not healthy for the fetus, but again, always consult your doctor. Well, how about breastfeeding? Same thing, essentially. There's no data from the trials per se, but theoretically, there's nothing that suggests that it would be a problem. Remember, the body is going to break down that mRNA almost immediately after your body makes proteins out of it. So none of this is transmitted to the baby through the breast milk, and there's no reason to believe that it would be harmful in any way to the breastfeeding woman or child. Immune suppressed people? Well, the studies were done with people who had well-controlled HIV, for example, and some other diseases that can cause a degree of immune suppression, such as diabetes. But there was no studies that were done on people who were really severely immunosuppressed. The concern, again, is not that you're going to get this mRNA and make a protein that will somehow be harmful to you. It's more so that the body may just not respond as well to the vaccine and may not have as good of an immune response in those cases. Yes, still get the vaccine, but keep wearing the mask and doing all of the precautions that are needed to keep us all safe anyways. And how about folks with allergies or a history of allergic reaction? Well, yeah, this is a legitimate concern, and honestly, the one to be most concerned with, so we'll talk more about this. People can and have had some allergic reactions, so it's not meant to be downplayed at all. There have been some cases of something called anaphylaxis to the COVID vaccine, though they are very rare. For that reason, if anyone has a history of anaphylaxis to anything, meaning severe allergic reactions, food, injections, anything, you need to be watched for at least 30 minutes after the vaccination instead of the standard 15 minutes. If you have an allergic reaction or any allergies that are not anaphylaxis, and you have never had to use something called an EpiPen, then your normal 15 minutes are fine. So let's stick with this category because it's worth exploring. And these are the folks who should not be vaccinated. And I really want to be clear on this. It is totally fine to vaccinate people who have had anaphylaxis to even food allergies, bee stings, medications. We just want to make sure that we watch you for 30 minutes. If you have a history of allergies that are not anaphylaxis, you are good to get the vaccination. And no history of allergies, well, absolutely, get the vaccination. If you have had anaphylaxis to other vaccines or injectable medications, then we really need to talk about the risks versus the benefits. You're probably going to be fine, but you need to take precautions. Be observed for a longer amount of time, but again, you should be fine. The people who should not get the vaccine, and we are referring to the Moderna and Pfizer vaccine specifically here, are people who have had allergies to any component of the vaccine. The main one being polyethylene glycol or polyethylene sorbate, which cross-reacts with polyethylene glycol, which can be found in laxatives as well. So if you've ever taken X-Lax and wound up in X-Lax or Miralax and you've wound up in anaphylactic shock and in the hospital, don't take this vaccine. You need to wait for another vaccine to come out. And I promise you, they are on the horizon. The AstraZeneca, the Johnson & Johnson, they do not have polyethylene glycol. Also, notice here that there is one thing that is missing on the list of these ingredients, and it is microchips. This is fake news. I am not joking, guys. There are no microchips in these vaccinations. It's nonsense. It's ridiculous. There are no microchips, and we are not going to hijack your DNA. Okay? I hope that was clear. So how about safety? Well, let's move on to the concerns about safety. And I especially want to get into a little bit more detail about what to expect after we get the vaccine, because I really just want everyone to make a really informed decision about this. As we explore this, I want you to keep in mind that we are comparing the short-lived side effects of a vaccine against the potential short or long-term side effects of actually contracting the COVID virus, the risk of the vaccine versus the virus, not only for yourself, but for the loved ones and for those who are around you. So when we're talking about side effects, we're talking about different things, okay? We're talking about the fancy word people use on the street nowadays is called reactogenicity, or the easy way of saying it is side effects. Does your body react to it? And to be clear, I expect your body to get some side effects at some point because this vaccine is very reactogenic. It means your body is making a good immune response when you have this side effect. And it's a good way of knowing that your body is doing what it's supposed to be doing. So I don't want you to think that these are negative, what we're going to go over right now, even though it may seem like it is for sure. So when we talk about normal side effects, and I promise I'm going to roll the slides in a second, there are different things that can happen. Let's take, for example, if I go to the gym and I go boxing, I'm going to expect to have the side effect of my arm hurting for 2 days after I go exercise. But if I go box and I come out with pink eye, that's not a side effect from boxing. It's because I picked up a virus, and that is considered an adverse reaction, something that we never expected to happen. So when we review these side effects, please consider them to be normal and common experiences after the vaccine. So here we're looking at studies reported by Moderna, but very similar with Pfizer. We're looking at different age groups here. Under 65 will be the blue category, vaccine versus placebo or non-vaccinated people, as well as 65 and over in the red. So the first thing that we're going to look at is local reactions, meaning, does my arm hurt? Is it tender, warm, red? Are my lymph nodes swelling? Meaning, are they reacting because we injected something? These are general things that are self-limited and can be treated with Tylenol. So let's look at the first dose. Pain. Is the vaccine going to hurt? Yes, the answer is yes, it's pretty likely. Just think of this as payback for all the kids that we've forced to get their vaccines at a young age, but it's temporary and it's not a big deal. Similar is the age group for over 65, but you'll notice a trend here with folks that are over 65. They still have a good immune response and protection, so we can't say it's because of that, but their reactions actually tend to be less. Who knows, maybe they're just tougher than us younger guys. As I mentioned before, the swelling of the lymph nodes under the arm, a bit disproportionate between the vaccine group and the placebo group. However, people in the placebo group also got it too. Again, we are injecting something, so we could expect a reaction. Swelling at the site of the injection and redness at the site of the injection, yes, that can happen with the first dose, but much less common. Let's look at the second dose. Oh, and that's the redness, excuse me. And let's look at the second dose here. This is where we see a little bit more response. And this is actually common with a lot of vaccines. So if you've ever gotten your shingles vaccine, you'll notice that your second dose was much more reactive than the first dose. And this is because your immune system has already started to create an immune response and is trying to defend you. So pain is very similar as the first dose, Swelling of the lymph nodes, local swelling and redness also somewhat increased when compared to the first dose, but not a ton of people are going to get that. And nothing that a little bit of ice and Tylenol can't help after the vaccine. And of note, you really do not want to pre-dose with Tylenol before you get the vaccine, okay, guys? Theoretically, it could reduce your immune response. And so fine to take Tylenol after you get the vaccine, but don't take it before the vaccine. And then now when we compare the side effects from local injections and other things, what we're looking at now are the systemic effects. Like, I feel really crummy after getting the vaccine. And these are what are often confused with COVID symptoms. But no, the vaccine does not give you the virus. So with the first dose here, we should expect...
Primera dosis deberíamos
I think we need to mute. So with the first dose here, what should we expect? Well, about 38% of people had fatigue after getting the first dose.
Sienten fatiga después de la primera dosis.
Interpreter, I think I can hear you. I'm so sorry. But what's even more fascinating is just how many people in the placebo group actually got fatigue as well. It's very interesting, actually. Same thing goes for folks over 65, fewer feeling overall, but still significant numbers in the placebo group. Same with headache, but also less in the placebo group. Muscle aches, same thing. Joint aches, a little bit less. Nausea and vomiting, mostly nausea. Most people won't be throwing up after the vaccine. You may also feel fevers, you may also feel chills. And at the very bottom here, some fevers, which occurred in less than 1% of the people that get the vaccine after the first dose. Now, when we compare the second dose, there is no question that the second dose will make you feel a little bit more crummy or not so great. Fatigue, headache, body aches, even a bit of chills, and even a decent percentage of people will get a fever after the second dose. So if you know that you have a propensity to be a part of this reactive group, you've had reactions to the flu shot in the past, we don't want anybody missing work because of this. So consider doing it right before the weekend, or create a plan in your office or your center, your school, as to stagger in case somebody does need to call out sick from the vaccine, so that not everybody is calling out sick at the same time. Most symptoms will only last for 2 days at the most. And here's the catch. We are in the middle of a pandemic. So if you get fatigue, body aches, chills, fever, what are you automatically going to think? Well, yeah, you're going to think I have COVID, right? Or this vaccine gave me COVID. But again, give it 2 days. Isolate if necessary. But if everything else resolves, then you can assume that it was from the vaccine, okay, guys? If it goes beyond 2 days, you may need to reach out to your doctor to discuss if getting tested for COVID may be more medically appropriate for you. Of note, the Johnson & Johnson vaccine does seem to be a little less reactogenic, so that may be an advantage. But when it comes to the vaccine, at this stage, we want everyone to get vaccinated. So picking which vaccine you get is not really a top priority right now, though one day in the future it may be. So even if you feel a little crummy after dose number 1, please make sure you get dose number 2. These are not meant to be given in a single dose. And that's it. You need both doses to get full protection. And for that matter, you don't have full protection for 2 weeks after your vaccine, after you've completed both vaccines, okay? Adverse events are very rare, and adverse events in the study population were very low and nearly the same as the vaccine as the placebo groups, meaning that wasn't stuff that was actually caused by the vaccine, but rather possibly just bad timing or bad things that would have happened in the population anyways. Like if someone had a heart attack, for example, things can happen in the general population, especially when you're looking at a study with over 70,000 people. It is bound to happen.
You
guys need to mute.
Anaphylaxis, thank you. Anaphylaxis, we talked about before, and Bell's palsy. I know there was a question that came about this. We've heard a lot about this in the news, especially before. There was a small imbalance of people with the vaccine versus the placebo groups. But again, It's expected that people in the general population will get Bell's palsy anyways. So it doesn't seem that the vaccine group actually had a higher risk. And now that we have immunized hundreds of thousands of individuals, we're still seeing that there's really not more of a propensity for Bell's palsy, but certainly something to be aware of for them to have seen and looked at. And the study of the safety is not simply going to disappear when you get the vaccine. In fact, we want people to tell us how we feel afterwards. We have vaccine adverse events reporting system known as the VAERS that you have to report. It's mandatory for any adverse events, whether we think it's caused by the vaccine or not. So if something happens later, we want to make sure that it is reported so that if any additional cases, any cases in the world come up, they can begin to associate it as a side effect. But this is around for every and any vaccine of note. And then there's a new system in place called the V-Safe. And we give you a handout for this information when you get your vaccine. And you can sign up via a simple text message. I encourage everyone to do it. And this is so that the CDC can tell how you're feeling afterwards. They'll check in with you, you can check in with them, and that way they can aggregate all of the data, put it together, and possibly help others in the future to make informed decisions about getting the vaccine. And remember the catch that I mentioned, and I want to emphasize this, I'll go quickly. Oftentimes, because the body is eliciting a healthy immune response to the vaccine, it may actually feel that you're coming down with the virus. Do not be confused between the possible side effect of the vaccine and the virus itself. Yes, there's a lot of overlap and nothing that 2 Tylenol shouldn't be able to help clear. But if you come down with anything like loss of taste or smell, please get tested for COVID, even if you got the vaccine. And if these symptoms don't go away within 1 to 2 days of the vaccination, again, it's likely not COVID, okay? Protection really does not set in for 2 weeks after you have been vaccinated. And a number of recent studies have shown that the action that we've been taking to curb the spread of COVID-19 has also helped decrease the spread of the flu. Hooray! And this makes sense, right? Because both viruses are spread very similarly. So if we're already washing our hands, covering our coughs, wearing our face masks, staying home when we're sick, sheltering in place, cleaning our surfaces, do we really still need a flu vaccination? Trust me, this question comes up and you probably have the same question. While these precautions are vitally important and can be rather effective, they're far from perfect, and we are still seeing plenty of diseases in spite of them. So when it comes to flu and COVID, there's really no substitute for getting vaccinated. And the reality is we have to look at the numbers. The big concern for any vaccine, as we mentioned, is anaphylaxis. There are no reported deaths with the vaccine, and I will repeat it again, none. So when we think about anaphylaxis, the risk of anaphylaxis from a flu shot is 1 in 1 million. The risk from anaphylaxis from either the Pfizer or Moderna vaccine looks to be about 1 in 200,000 or less. So it is still exceedingly rare. So if we put this into perspective, however, if you go to the doctor and you're prescribed penicillin for the first time and you go home and take that antibiotic, you have a 1 in 5,000 chance of coming down with an anaphylactic reaction to that antibiotic. So to put it in perspective, 1 in a million, 1 in 200,000, or 1 in 5,000, you're actually more at risk with a vaccine than you are with, more at risk with an antibiotic than you are with the vaccine. And if you take that same 200,000 people, because there's a 1.7% chance of death, over 3,000 people will die in that same group that may have the potential to have an anaphylactic reaction. Remember, the risk associated with the vaccine is far, far less than the risk of the fatal potential outcome from the virus itself. I take a moment to pause here so you can read that really quickly. And so when it comes to the vaccine, please don't let your guard down. Continue to follow all of the current guidance and to protect yourself and others. Wear your mask, stay 6 feet apart from each other, avoid crowds, wash your hands often, keep doing all of the things that you're supposed to be doing. Remember, no vaccine is 100% effective, and it is too important right now to protect yourself and those around you to be careless about it also. And make sure that you take the time to give yourself the understanding of the COVID vaccine to make sure that it's right for you. Remember, it's going to take months, if not through the summer, for us to be able to vaccinate everybody who wants to be vaccinated. So we have to continue to remain cautious. Getting the vaccine does not give you a card that says, I need to not wear my mask anymore. And remember, there's really no downside to getting the vaccine unless you have the allergies that we discussed it. But there is really no good reason not to get it, and every reason to get it to protect ourselves and our families and all of those that we care about. And lastly, I will stop talking, but I want to thank everyone. I know that it has been a very challenging time for all of us right now. The world is a mess. Our birthdays, holidays, everything in life has been turned upside down. But I want to thank you all for all of the hard work that you've been doing to stay responsible in keeping yourself and others around you healthy and safe. And with that, I will stop speaking. And I know that we're close to the hour because we got a late start, but I'm here for you guys if you have any questions.
Thank you very much, Dr. Petrick. That was great information. We do have questions, like you said. So I like to bring in our union's vice president, Thomas Parker, who has a couple of questions for you. Elizabeth?
Okay, hello, everyone. Thank you, Corrado, and thank you, Dr. Petrick, for joining us tonight. Our first question is, can we catch the COVID from children?
Well, that's a great question. Thank you so much for asking it. So we know that kids are not going to get the COVID vaccine anytime soon. So one of the most important reasons for us to get vaccinated is to protect our kids, right? Kids are really not the ones that are bringing home COVID from school. They're the ones that are getting it from us, the adults. So protecting the kids before they can get vaccinated is really important. Even though it seems like they're not the ones that are getting bad infections with COVID, we do still hear about some cases of COVID, of MISC, that more severe systemic reaction that kids get. And so we don't want to see that in our students and our families. So it's important. Kids can catch COVID, but it's more common that we give the kids COVID. So let's do our job to protect the kids.
Okay. And the next question is, if you get the vaccine, can you still get coronavirus?
So I get this question a lot, especially with what are the chances of spreading COVID to others after I get the vaccine? Because we know that it's a 94 to 95% effectiveness, right? So can you spread it? Well, the answer is, if I had to guess, I would probably say it's unlikely. But no one is comfortable saying guess, so I can't just guess. So the recommendation after getting the vaccine is still to wear masks, social distance, hand wash, and all of the hygiene practices that we know just in case. Because what we don't know definitely right now is if you get the vaccine, yes, it decreases the risk of getting symptomatic COVID infections, because that's all that the studies really were designed to look at. But the studies weren't designed to tell us if we were at risk of getting an asymptomatic COVID infection or even being a carrier to give it to other people. So we don't know if you can have COVID without any symptoms after getting the COVID vaccine, then we really can't answer that question, right? We need more information, and that there are studies that are going on about this right now. There are studies that are designed to look specifically at that. But when we look at COVID itself and the spread of COVID, we know, number one, the most common person who gives COVID or spreads COVID is somebody who has symptoms, or number two, somebody who is pre-symptomatic, meaning they're going to come down with COVID. They're just in their 2-day window before. Asymptomatic COVID carriers tend to spread it a little bit less. So if we bunch ourselves, the vaccinated one with the asymptomatic carriers, we can assume that we're less likely to carry COVID, but we really don't know yet. And that's why they're doing studies to try and find that.
Okay. Is the vaccine effective for new strands coming out?
Yeah, so that's a really big concern that's on everyone's mind right now about those variants that are out there, right? So the big question is, how effective are the vaccinations against the current strains and the current variants that are coming out? And the answer is that they're pretty effective. Both the Pfizer and the Moderna vaccine to cover both pretty well, especially that British strain that's pretty prevalent in the US right now, that B.1.1.7 that everybody's talking about. We know that the British strain is more transmissible and unfortunately even more deadly. And it seems based on the studies that are happening in the US right now, it may actually be the common form of COVID in the US within the next month or so. So the good news is that our current vaccines seem to be successful against the British strain, similar to the one against the typical strains that we've had until now. But the South African strain, which I think is only in 3 states right now and only 3 cases in the US, seems to be more similar to the Brazilian strain and is a little bit different. It also seems to be more transmissible, but it's unclear if it's more deadly. Probably is. And it seems that the vaccines may be a little bit less effective against that one. So we're hoping that those do not continue to spread. Pfizer says it's pretty much effective. Moderna says it's a little less effective against those strains. But even if you get affected with those strains, I really want to clarify this, because imagine the flu. The flu vaccine that we get every year is only about 30 to 60% effective. But what it is effective in is not preventing everybody from not getting the flu, but it reduces the chance of death and hospitalization. So what we do know are the current vaccines are safe against preventing severe diseases of COVID, even if those other variants are out. Of note, the AstraZeneca got pulled in South Africa because it wasn't effective. So long story short, it at least protects us from the disease. We just may have minor infection of the virus if we don't have 95% protection from the variants.
Okay, I have one question myself. What about people with diabetes and cancers? Any side effects to these vaccines?
No, not. Oh, thank you for answering that, asking that. No, again, the studies were done on the immunocompromised. That was on that slide of who can and can't get the vaccine. Diabetes was a part of that. We want people to get it. And again, it's not get the vaccine, not get the virus, because we know that it protects you. The problem is with people who have a bit of immune suppression, it means your internal immune response may not react as good. And so when your response doesn't act as good, it may, instead of 95% effective, it may be 85% effective. Those are completely rhetorical numbers. Please don't stick with those. But the immune suppression just means your body's own immune response may not be as heightened as somebody who has a strong immune response, which is why we need to continue the masking, hygiene, and all of the other practices that we already do right now.
Okay. What about kids and teens? And what are the studies for students that are younger than 15? And what are the chances that they will be vaccinated for them?
Yeah. So let's talk about kids for a moment. Moderna, and we went over this. Moderna went down to 18 years of age. Pfizer went down as low as 16. And this was the initial study. And this is all that they're approved for. So what about teenagers? Well, Moderna and Pfizer both have studies going in kids down to 12 years old now. And once those studies are submitted and approved, we'll see the vaccine age drop down to 12 years old. And that's important because we know that teenagers often behave very similar to adults. They can spread it similar to adults, and some of them can even get similar complications to adults. Moderna also actually is recruiting for kids between the ages of 6 months and 11 years old right now. And they're hoping to get that trial started by March.
So I'm planning to play.
Can we mute, guys? Sorry. The problem is that they are having a little bit of trouble recruiting because it's really not easy to get parents to subject their kids to needles, nasal swabs, blood draws, multiple shots, but it is really important that we start studying that age group. So when it comes to schools, the most important thing for now is getting those teachers and staff immunized to make sure that you guys are safe and in turn persuade the kids to follow the rules that they need to ensure that everyone is safe in the school.
Okay, can you experience side effects from the vaccines months after you take it?
So I would encourage you to continue to monitor and report your side effects to the adverse reporting agency that we discussed in the presentation. There are really no known delayed reactions that should come about months later or a month later. Of note, there is only one phenomenon that I'm aware of, and it's called Moderna arm, where you can actually get redness, itchiness at the site of the injection starting about 1 to 2 weeks after the vaccine. Some weird delayed hypersensitivity reaction, but nothing that Motrin and a little bit of Benadryl or allergy medication can't help go away, but very weird. And this only happens with Moderna. It does not happen with Pfizer. Either way, it would be worthwhile to discuss with your doctor if you are experiencing any symptoms, as it is not common to have prolonged vaccination side effects. So talk to your doctor about any symptoms that you can be having to determine if there is another medical reason for why these symptoms are coming about instead of the possibility of vaccine association.
Okay, one last question. Is it safe to go to school if a coworker tested positive a few weeks ago, but is now negative? However, they still show side effects of COVID like fatigue and wheezing.
Oh, bummer. That's no fun. So the CDC recommends that people who have been infected with COVID-19 isolate for 10 days. They can come out of isolation after they've had no fever without medication for 24 hours and improvement of their symptoms, not absence of their symptoms. In this case, if they've already had a negative test result, which of note, nobody should have to have a negative test result to return to work because we know that it can actually stay positive for months after the infection. But I digress, totally different subject. So if somebody comes back with improvement of those symptoms and has a negative test, they're probably, unfortunately, a part of what we call those long haulers, or people who can have continued long-term effects of COVID. Residual symptoms does not mean that they are still infected. It just means that they had a disease that's unfortunately, the side effects are lingering, which we're seeing more and more with lungs and other things. And so for them, it's best for them to go to the doctor. If they're wheezing, we can give them albuterol, but you are safe. Wheezing and coughing is a common side effect, unfortunately, especially if they had a bad lung infection with COVID. But again, maintaining the hygiene, the distancing, masking, washing your hands, all of those are really important to continue to do in the workplace to make sure that everybody's protected.
Thank you so much for your time. I'll turn it back over to Conrado.
Sure.
Thank you very much, Elizabeth and Dr. Petrick. You know, in the upcoming weeks, many Local 99 members will have the opportunity to get the vaccine, and this information is going to be very helpful. Thank you very much, Doctor.
Yeah, and guys, just continue to go on your local public health, or if you're Kaiser Permanente members, I'm sorry, I'm not hijacking your conversation, because I saw this question earlier, kp.org/COVID vaccine. There are a lot of great resources of when it's your turn to get tested and where, vaccinated, and where you can get vaccinated. So please just go on, look for your local, go on the local public health websites. There are really great places like myturn.com that can help guide you as to where you can get the vaccine and when you're eligible for it. Okay. And with that, thank you guys. Please stay safe. And thank you everybody for all of the hard work that you're doing.
Thank you very much, Doctor.
Thanks, guys.
And the link is posted on the chat. We do have information on our website. We'll probably have that link on our website. And we continue to work with Kaiser and the Los Angeles County Health Department to make sure that we have the most information we can, and to continue doing these webinars regarding the vaccine so that members can feel more comfortable taking it if they choose to. Thank you. doctor.